Hi, my name is Rose-Marie Perrault. I'm a neuropsychologist at the Jewish Rehabilitation Hospital in Laval, and today I'm presenting to you an information session on sex and intimacy after a stroke. The objectives of this information session are for you to become aware that it's completely normal to go through changes and to have concerns about your sexuality following a stroke, to get to know some of the possible adaptations that can promote intimacy and a return to sexual life after a stroke, and to know what professionals you can turn to if you wish to further discuss your concerns about sexuality and intimacy. Why is it important to talk about sexuality and intimacy after a stroke? To answer that question, I would like to begin by reading to you two excerpts from a statement that was produced by the World Health Organization about sexual health. Sexual health is fundamental to the overall health and well-being of individuals, couples, and families. Sexual health, when viewed affirmatively, requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. This goes to say that sexuality is a fundamental part of our overall health, well-being, and quality of life. Now, what do we mean when we talk about sexuality? Sexual activity refers to engaging in satisfying sexual relations that can meet needs related to relationships or reproduction. It's a concept that has evolved through time and that can vary throughout different cultures or from person to person. And it's relevant whether we are in a relationship or not. Sexuality is a complex function. It depends on several abilities, like physical abilities, emotional and mental function, sensory function, communication, and neurological disorders like a stroke, multiple sclerosis, Parkinson's disease, or spinal cord injury, for example, can have an impact on sexuality and require adaptation. So it's important to note that rehabilitation therapists can assess impairments and disabilities that may directly or indirectly affect sexuality. To give you an idea of the numbers, there was a study that was done in Finland in 1999 on 192 people who were on average almost 2 years post-stroke and who were asked about their sexual life following their stroke. And what was found is that out of that sample, 75% of the male participants reported problems with their erections. 67% of the participants reported having fewer sexual relations or having completely stopped having sex since their stroke. 57% of the sample reported lower sex drive. 55% of female participants reported fewer orgasms. 49% of the sample reported dissatisfaction with their sexual life. And 46% of the female participants reported less vaginal lubrication. So this really shows you that these concerns or these problems are quite common after a stroke. After a stroke, many changes that occur can affect your sexuality, and the sources of concern can be varied. So here I present to you some of the most common concerns or problems that stroke survivors or their loved ones tend to report. First, as we just discussed, many people who have had a stroke experience a decrease in sex drive, either with a partner or by themselves. And as we also discussed, there are physiological changes that can occur, such as the decrease in vaginal lubrication or ability to have orgasms, or difficulties with erections or normal ejaculation. And of course, if you're in a relationship with a partner, this can add pressure, frustration, or a fear of not performing, which can obviously make the relationship even more stressful. Something else is that there is a very common fear of having another stroke during sex, but it's important to mention that there's no evidence to suggest that having sex will cause you to have another stroke. However, if you have medical concerns or just want to clear your head before resuming your sexual relationships, it's perfectly fine to consult your doctor about this. And something else is that it's also quite common for stroke survivors or their partners to experience depression. And if so, this obviously has an effect on your interest in sex or intimacy. And the same goes for anxiety or pain, for example, which can often be present after a stroke. But there are treatments for these conditions. So if this is something that you may be experiencing, I encourage you to talk about it with your doctor or one of your therapists. Among other common concerns, certain medical conditions can have an impact on resuming your sexual life, such as incontinence, wearing a catheter, or a pacemaker. And you may have questions regarding how you will be able to deal with these things when resuming your sex life. Certain medications, for example, those prescribed for blood pressure, may decrease sex drive or the ability to have an erection or to lubricate. And so you can check with your doctor to see if the side effects of some of your medications can have this kind of impact, and if they can adjust your medication to lessen these impacts. Fatigue is a very common symptom after a stroke, and it can be amplified if you've had a busy day or if you don't sleep so well. And obviously, if you are feeling tired, it tends to affect your desire to engage in sexual activity. And finally, a stroke may also have caused changes in your body, for example, a paralysis or a weakness on one side of your body, or a loss of feeling in some places, or it could have changed the way you can speak or express your emotions. And all these things can affect your self-image and your self-confidence. You may wonder if you'll still be attractive for your partner, for example. And adjusting to these changes, to this new self, can take time. For people who have a partner, you and your partner may have some unspoken fears and avoid intimate encounters because of them. Your partner may, for example, be afraid of causing another stroke or causing you pain or putting you under pressure to resume sexual activity. But delaying intimacy tends to actually increase anxiety around sexual intercourse. And so it will be important to find ways to communicate with each other in order to overcome these fears. You and your partner will need time to adjust to these changes, and it will be important to talk openly about your feelings, their feelings, your fears and their fears. And if this is difficult, it can be a good idea to consider seeking marital counseling or help from your social worker or your psychologist. Regarding communication difficulties, if after the stroke you have aphasia or any other disorder that affects your ability to communicate, it may be difficult to express what you want to say or even to understand what your partner wants to say to you. And this obviously adds a challenge because you have to find new ways of communicating. And in that sense, your speech language pathologist can be a valuable ally. Having a stroke can also affect the dynamics of a couple because, for example, our spouse suddenly becomes our caregiver and helps us in our physical care. And then we can feel that it's harder to get back into our role as lovers. And this can be a difficult adjustment for both partners. And it's important to acknowledge it and name it so you can talk openly about it. And if this is an option, it may help to find another person to help with the physical care, to make room for the couple that you are. And it's also important, as much as possible, to take time for yourself, to recharge your batteries. And finally, in terms of fertility, if you have had a stroke, it's important to discuss with your doctor if you want to take an oral contraceptive like the pill, because some of them have cardiovascular effects. And it's also important to talk to your doctor if you want to get pregnant so that he or she can discuss with you how pregnancy can affect you. Adapting to the changes that were caused by the stroke takes some time, and although I've said this already, it's important to repeat it because you will need to give yourself that time and to give yourself some patience and some compassion towards you, your partner. And if you do have deficits or problems after a stroke, there are adaptations that can be made to help restore your sexual life and help bring back the pleasure you had in your sexual life. One of the things that can be very useful is planning ahead of time. So even though this takes away from the spontaneous aspect of sexuality, planning ahead of time allows you to feel well rested, especially if post-stroke fatigue is something that affects you. So choosing a time of the day where you know you are usually well rested and planning enough uninterrupted time for you and for your partner can ease the mood as well as the experience. And you may also set the mood or the tone by taking into consideration the lighting of the room you're in, the music, making the place peaceful and comfortable. So really just setting the stage to resume a pleasurable experience in your sexual life. Another way of adapting to the changes that can happen following a stroke is to explore alternative sexual activities. Traditional ways of making love can be reintroduced, but there are other ways to succeed in meeting the needs of both your partner and yourself, including self-stimulation like masturbation and oral sex. Sexual activities could also be done in the shower, be it in a couple or alone, to keep into consideration any accidents such as urinary incontinence. The use of vibrators, creams, lubricants, and other tools can be explored to conserve energy, to facilitate your experience, as well as limit pain and discomfort. And when a partner is involved, showing affection is a big part of demonstrating your desire, yet this can be more difficult following a stroke. But there are many ways of showing your affection, and so exploring alternatives with your team members can open up possibilities for fostering a pleasurable return to sexual activity. Physical limitations, as well as sensory losses or hypersensitivity, can make certain ways of showing affection more difficult. So based on your physical evaluation, your occupational therapist and your physiotherapist can provide you with written educational material on varied positions that can be explored. be it in sitting, lying, standing, to allow for a more comfortable experience. So positions like lying on your back or in a spooning position can favor more support, as well as take into consideration any muscle weakness or altered tone and pain that can be present or amplified in other positions. Your physiotherapist and occupational therapist could also recommend varied tools to manage pain and hypersensitivity to help you conserve energy and limit subsequent pain or fatigue following sexual relations. And finally, involuntary and unpredictable muscle contractions may occur during sexual intercourse, which can further limit your capacity to perform and your overall enjoyment. So exercises and stretching before planned sexual activities alongside alternate positioning can be helpful in limiting these barriers. As you can see, there are many options available to help you resume a satisfying sexual life following a stroke, whether it's through exercise, positioning, or planning. Yet, difficulties can still be present, and this can be very frustrating. For example, as I've mentioned earlier, certain medications that are necessary to better manage stroke-related issues or comorbidities such as hypertension, diabetes, and spasticity can have negative side effects. So if you are still experiencing difficulties with your sexual life, there are several professionals that you can talk to. First of all, there's your family doctor or a specialist that can explore with you options to manage pain or spasticity, or erectile dysfunction or vaginal dryness, or to facilitate mood and sex drive. You can also talk to any member of your rehabilitation team with whom you feel comfortable, whether it's the physiotherapist, your occupational therapist, your speech therapist, the psychologist, social worker, the nurse, the specialized educator, or the team coordinator. And certain issues can require someone with a little bit more expertise in couples or in sexuality. So, for example, sex therapists or psychologists and psychotherapists specialize in these issues can be a great help.